Hi everyone. You're very welcome to tonight's live. Tonight is going to be all about LED therapy, and I'm going to be chatting to Denise Ryan, who is the Vice President of Celluma LED in California. And Celluma is the type of LED device that I use in the Floraison studio, and I also use it at home, so I have one for the studio and one for home use. And I wanted to do I wanted to do a live this evening about LED because even though it's been in the industry for ages, it's really exploded recently, and with that comes a lot of confusion about LED, which are the best devices to use, which lights work, which don't. So that's why I wanted to do this tonight. A little bit of education, a little bit of myth busting, and Denise is going to help me with that. So I think she's just joined here. Denise, how are you?
Great, how are you?
I'm good, thanks. I'm good. Thank you so much for joining me this evening.
Well, thank you for the invitation.
I was just telling everyone that's watching a little bit about LED. Well, I was just about to start, but do you want to introduce yourself?
Yes, definitely. So I'm Denise Ryan. I'm the Vice President of Brand Management here at Celluma Light Therapy. We are based in Southern California, but we we're registered to sell as a medical device in 78 countries worldwide, including my home country of Ireland and my home city of Dublin. So this is
I actually forgot to mention that, that you're actually from Dublin and living in California.
I am. I used to speak just like Dawn. So I did. Over 30 years in the US, and now I'm longer in America than I was at home, which is sort of sad for me. But my whole family are out in the Swords area, so I don't know if anybody's watching.
I'm literally just around the corner. Literally around the corner from them. I'm around the corner from them.
Yes. So they don't bother to follow us on Instagram, so I don't think anybody's watching today, but they might be. So hello to all the Ryans all over the world. And delighted, obviously, to be here with you today, Dawn, because you're actually the first Instagram Live that we've done in the Republic of Ireland. We were with Victoria Shields up in Europe about a month ago. So this is very exciting.
Yeah. I'm very privileged. That's great. And I was just saying, as we started, how, the reason I wanted to do a live around LED, Denise, is because I suppose LED has been around for years, but it has just absolutely exploded in the beauty industry lately. And when anything explodes, there's always confusion. There's always, there's so much choice. What do I go for? What works? What doesn't work? Why should I go for this one over the other? So I did put up there a couple of days back for people to submit some questions, and some really good questions were submitted. And, I'd love to go through some of them with you and kind of get your 2 cents. And, obviously Celluma is the brand, the device that I use at Floraison. I was saying to people that just joined, and the device that I use at home as well. I have one for the studio and one for home, and I'm absolutely obsessed. Like, the results are just incredible. But again, lots of people have lots of different questions about LED, what it does, and what makes all the different devices different. There's a lot of sexy devices out there at the moment. So kind of just it'd be good to get through some myths and some facts and so forth. So one of the first questions that come in is, why Celluma? Now, I obviously know why Celluma, but why would somebody go for Celluma over anything else?
Great question. So when we entered the market, which is now almost 10 years ago, there were a lot of devices, LED devices, already on the market. But they were all similar, and they were all large, bulky, but medical grade style devices. And they were mostly for professional use only. And they were extremely expensive. So we took a look at the science behind light therapy and decided that there was really no reason for the expense in the LED devices. And there were also a lot of the known scientific parameters for effective light therapy were missing from almost all of the even professional devices on the market. So they worked, but they weren't designed to optimize the delivery of the light energy to the tissue, and it's all about how much energy actually is absorbed by the tissue. So we put all of our effort into following all of the known parameters for effective light therapy and optimizing those parameters. And in doing so, we also realized that we could eliminate a lot of the, what we call the expensive superfluous hardware, meaning the stands, the big heavy equipment, like the box that it stood on and all that sort of thing. And in doing that, we came up with a much more efficient, more effective, but a lot less expensive device that actually was doing more than the devices at that time, and that still stands today. So today, Celluma is more versatile, meaning one device does more than those professional grade devices that are still on the market today, but for a lot less cost to both the practitioner. But today we also have devices that are approved for home use. So in order to approve devices for home use, if you're a medical manufacturer and have to go through all of the requirements to be approved as a medical manufacturer, there's a lot that goes into making a medical grade LED device. But if you want to sell it and make it effective for home use, you actually have to provide a higher standard of data for both efficacy and safety, and get that cleared so that people can use it not just professionally, but also at home in the hands of a non-professional. And that has been very popular, but it's exactly the same device. So that was one of the innovations. The other thing that you have to be aware of, whether you're buying for the clinic or buying for home use, or renting for home use, which I think you do, you have to be sure that you're getting what you think you're getting. And a lot of the devices that are out there, you refer to them as like the sexy devices. A lot of them are not medical devices. So they haven't been reviewed and they haven't been approved by the medical device authorities in Europe or in Australia.
Yeah, well, that was actually one of a big question that was submitted over and over again. Why is it important for a device to be FDA approved?
Right.
You know,
so
FDA-cleared.
In a nutshell, if it has been reviewed by the FDA, at least you know that it's likely safe and effective for use. Just to give you an example, if you were to buy something not approved by the FDA, or in the case of Ireland or the UK, EU approvals or clearances for use, then you could be buying a device and investing quite a lot of money in a device that might simply have white bulbs with colored glass over them. You won't know what you're getting, and you're taking a huge chance. There are, like you said earlier, LED has really exploded all around the world in the beauty and the aesthetic market. And frankly, we take credit for that. Until Celluma came along, devices were so expensive and so large and bulky that it really was only the medical practitioners that could afford them and that offered them. So our goal right from the very beginning was to bring light therapy benefits to the masses. So we were always interested in having not only the most effective light therapy device on the market and following the parameters to make sure it was the most effective light therapy device on the market, meaning get you the kind of results you expect and should get from a good light therapy device, but also that it wouldn't break the bank. It wouldn't be, it would be something, there would be something in there for everybody to, regardless of budget. And our devices literally start in euros at 299. Now they do go up to, we have full body devices that go up to like 15,000 euro, but there's something in that range for everybody. And quite honestly, while that was our ultimate goal, really what has happened is that professionals like yourself are now able to bring into your clinic affordable, effective light therapy that you can in turn offer light therapy services to your clients at a rate that they can afford. So it's really a nice pull through. We make the most effective device. We've made it so that it's affordable for practitioners and end users alike. But as a result, our practitioners just like you, all around the world, are the people that have really increased awareness of the benefits of light therapy, because
Exactly.
the device is affordable, and in many cases it allows practitioners to have several. Some places have many treatment rooms, so you want one in every room, but you can actually afford that with a device like Celluma. And as I said, you can afford then to offer light therapy treatments that make sense and are in a price range that are accessible to the average person.
Yeah, and work, obviously, that they produce really, really amazing results even after one go. You spoke a little bit about white lights that can just be colored to, you know, we'd say like amber, purple.
Like a Christmas tree light.
Yeah, and like there are a lot of devices out there, you know, that say that there's amber, there's purple, there's green lights. Talk to me about those, because you know, the masks, and they have all these different lights to help with pigmentation and so forth.
So again, there are only a few proven wavelengths of light that are going to be effective for skin conditions and for pain. So in a nutshell, unless you're treating acne, then you need blue, because that wavelength is proven to kill the acne bacteria that causes acne. But apart from acne, treating all other skin and even pain conditions requires red and near infrared. And those are proven and supported from over decades of peer-reviewed and published credible scientific research. So when it comes to, you know, purple, there is no such thing as purple. Now there's ultraviolet, but that's in a wavelength that's short, and it's not a wavelength that's used in therapeutic light therapy devices. So if you see ultraviolet light or purple light, you don't want to go anywhere near that. And then you see things like yellow light and amber light. Those are not wavelengths, again, supported by the scientific literature. So if you go to, as we do all the time, aesthetic medical conferences, you'll see a lot of, especially mask type devices on the trade show floors or on the conference floors. And a lot of them are saying, oh, we have 7 different lights. And if those are the devices you really want to run a mile from, you want to work with a device that has the clinically proven wavelengths. The only ones you need, red, blue, and near blue, red, and near infrared. The rest of them is just going to be a waste of your time. They do not reach deep enough, even if they're actually wavelengths. They do not, and not colored bulbs, they do not reach deep enough into the tissue, meaning into the dermal layer, where a lot of the skin issues reside, and therefore they will not be able to increase the cellular activity at that level in the tissue, so you will not get the results. So I just usually say, when somebody asks me about those, I just say, look for a device with blue, red, and near infrared, whether it's Celluma or some other brand. And anytime you see somebody selling anything with amber, yellow, green, purple, pink, run a mile, because they're not true LED devices, and they are definitely not medical grade devices.
Yeah, and like, you know, you were saying a while ago about masks, you know, there's a lot of masks out there at the moment, and it's like, you know, 10-15 minutes. Celluma is best used for 30 minutes. How do you get around, like, what's your view on that then? Can it work in 10 minutes, or do you think it has to be longer?
So here's the way I explain how long or the duration of time needed to generate a result, an observable result. And it's a little bit like going to the gym. If you go to the gym one time and never go again, you're not going to see any results, certainly not any observable results. If you make the commitment to go twice a week for a month, internally you're going to start to feel a difference. And even if you can't see it yet, that difference is underway. If you continue with that same commitment 2 or maybe 3 times a week for 4 to 8 weeks, now you're visibly seeing a difference in the body. The body has had enough time to tone and strengthen, and you're going to start seeing a change in appearance and the shape of your body, and you may even be losing some weight at this point. It's the same with a good diet. I often say, you know, you can eat broccoli one time, but you're not going to see that glow to your skin that leafy greens might give you if you incorporate them into your diet regularly and over time. And it's the same thing with light therapy. If you come across devices that are recommending 3 minutes and 5 minutes and even 10 minutes, then it's likely that they're doing that to sell against a quality medical grade device that's saying at least 20 and maybe even up to 30 minutes. And the reason that us medical grade devices say that is because this is on scientific research. The scientific research doesn't support any value to a 3, 5, or even 10-minute session. It takes the cells a certain amount of time in order to absorb enough energy to affect a change at the cellular level. And that doesn't happen instantly, just like going to the gym or just like eating your broccoli. And if you think about going to the gym, it's usually recommended a minimum of 30 minutes. It's the same thing with light therapy, and it's not just applied to Celluma. Any good medical grade light therapy device will require at least 20 minutes, and we recommend up to or as close as you can to 30 minutes because we want enough energy to be absorbed so that the changes at the cellular level are occurring not just during the treatment session, but have enough energy for that change and that improvement, whether it's cell proliferation, cell migration, DNA synthesis, RNA synthesis, whatever it is that's occurring, for that to occur over the course of the next few days. That's why a twice-a-week treatment protocol is really good for light therapy. Today is Monday. So if you had a client into your clinic today, and it's Monday, if they do a Celluma treatment and spend at least 20 or 30 minutes under the Celluma, they're going to benefit from that treatment right into Tuesday, Wednesday, and possibly into Thursday. We haven't measured beyond that. And if you do another one Thursday or Friday, you have residual effects from that. So you're really getting a benefit that will get you through a whole week, and then you start again next week.
Yeah, absolutely. Because I've had clients that have had one treatment, and the next day they're like, "Is this normal for me to see so much, like such good results?" And then even the next week they're like, "I'm still seeing results. Is this real?" Like, so yeah, it's fabulous. Yeah, it's really effective.
You don't want to shortcut anything. If you're really committed to results, you really need to follow the protocols that have been laid out for us by the scientific researchers. And as I said, it just takes the cells a certain amount of time to absorb enough energy, and then you want to continue with the process. Having said that, trained skincare professionals like yourself do report seeing a benefit even after one use. But if you but we continue to age every day. So in order to, and it's a chronic condition. We never stop aging. It's not like we cure it and we get better and it stops. We don't. So incorporating it as a protocol into your anti-aging plans for the future is really the way forward.
And I suppose, how many times a week do you think is best to use an LED device?
So again, a good LED device like Celluma, our official protocols are 2 to 3 times a week. You can use it more if you happen to have, somebody rents one from you and they have it at home for a month or something like that. I don't know what your rental plan is, but they can use it as often as they want. It's really almost impossible to overcharge the cells. Think of it like your cell phone plugged into the wall. When your cell phone is charged to 100%, it doesn't go to 101 or 105. Yeah. It's just, it has enough energy. So so you really can't overdo it. So as I said, the official protocol is 3 times a week. In practice, most people settle at about twice a week. If you're trying to get a client into I think you're on Exchequer Street in Dublin, if you're trying to get somebody in, coming in twice a week is reasonable. When it gets to be more than that, unless they're really working close by, it might be a little too much of a commitment. So a twice a week protocol actually works really well. If people can't get in twice a week, once a week will work. It will just take longer for them to get to the end result.
Yeah, and those that are using Celluma at home, I would usually say, like, have your Celluma nights, basically. So you might have a Monday night, a Wednesday night, and a Friday night, or
That's perfect.
you know, have the nights, because you know it does take 30 minutes. You are taking 30 minutes for yourself to lie under the device. But yeah, I usually say about 3 times. LED for rosacea and other skin conditions like that, so psoriasis, dermatitis. What's your view on that?
Okay, so LED has been shown to be very effective against any inflammatory-based condition. There isn't any medical grade light therapy device on the market that's actually got indications from either the EU medical device authorities or the FDA for any of the conditions you just mentioned. So medical companies like us will not make claims to treat those conditions because that would be wrong and we're not allowed. So that's another reason to be very careful about the company that you go with. You might find a company on Amazon and they've got 7 different colors and we treat, you know, a whole slew of things, a whole list. They're actually not qualified to make those statements. And it should be a red flag to people to run a mile. A company like us that is the #1 selling device in the world, registered as a medical device in 78 countries, and has won almost 40, I think it's over 40 aesthetic awards since 2015. Even we can make those statements. But that tells you that, you know, that indicates the integrity of a company. So, but what I can tell you is that anything where the root cause of the issue is inflammation, and anywhere where increasing circulation may help that condition, it's very likely that your LED device is going to address that condition. And red light has been proven to treat a lot of those skin conditions very effectively.
Okay, great. A few people got on about questions about like broken capillaries and pigmentation and LED.
Right.
Does it make it worse or can it help?
I haven't seen a lot of research, and again, everything, we're committed to research, and we're also committed to the truth. We will only share with you that information which we know to be scientifically proven and accurate. So I'm going to tell you, I've not seen, it could be out there, but I personally in 10 years have not seen a lot of benefits with broken capillaries, especially in the face. What I have seen is that there are laser devices that treat that condition quite well. Now, when it comes to pigmentation, again, that's a very tenacious condition. We all have a little bit of pigmentation. But again, the cause of pigmentation is often hormonal, but mostly it's exposure to UV light from the sun over, you know, when we go on our holidays and all of that. So we don't get too much sun in Dublin, but it doesn't matter. It's out there in the atmosphere the whole time. So we all end up at some stage with some degree of pigmentation. So light therapy is, again, it's not a cleared indication for any professional LED device. And frankly, what I've seen is that red wavelengths seem to be the most effective in the research that I've seen on pigmentation, specifically for melasma. Dr. Barrelay out of McGill University in Canada has done a lot of research on light therapy, and he, I think it was the end of 2019, or maybe it was the end of 2018, he released really the first ever paper using LED, research study using LED to treat melasma. The study was rather small. That was the only thing that I would have an issue with. It was a small sample size of people, but he had really good results using near infrared. But he was using it also in conjunction with microdermabrasion. He was doing the microdermabrasion first to remove the dead cells and then doing the light therapy. But he did have good results. And interestingly, when they went back and visited the clients quite a time afterwards, the benefit was very cumulative and ongoing, even months after the treatment ended. I think it was 8 weeks of treatments once a week. So that was the most interesting paper that I'd ever seen. And again, they used a near infrared, very similar to the wavelength in Celluma, to get those results. So that's...
yeah, and a great thing as well about the Celluma devices, obviously they're bendy. You can really mold them around the area that you want to use them on.
Right.
Yeah.
So here's one right here. So yes, it is flexible, but when I say to everybody, flexible has no relevance if it isn't shape taking. So most devices that are flexible, when you let them go, they spring flat. And there's no part of the body that's actually flat. So putting a flat device anywhere on the body is kind of pointless. But the nice thing about Celluma is you can form this C shape, which is ideal for placing over the face, and you get full ear to ear, chin to hairline coverage. But you're also emitting the light energy at a fairly constant distance from the tissue. And the closer you can place your light energy device to the tissue, and the more uniform that placement, the more energy that's absorbed by the cells. And that's another reason that Celluma gets these really, really good clinical results. So flexible is great, but the fact that it can hold its shape. So it can hold whatever shape I place it in. Now, there isn't any part of our body like this, except maybe if you were treating an arm, you can put it over shoulders, follow the curvature of the spine. And then, of course, you can do that nice face, neck, and décolleté position, and no other device can do that.
Yeah.
So it's,
Or you can use it on the face for half an hour, put on a movie, you put it on your chest for half an hour, put it on your hands. That's how I love to use it. So kind of like an hour and a half treatment of Celluma. So it's,
I use Celluma a lot. The only time that you sort of have to lie back and lie down with Celluma is when you're doing your face. Otherwise, if I'm doing the chest area or my hands, or I have any kind of ache or any problem anywhere else in the body, I usually do it in the evening watching TV. That's if I'm at home. For you practitioners, you can also use Celluma. And I always remind practitioners, don't forget while you're working on the face, which is the area you're most likely to be working on, you can do the back of hands. You can do knees, you can do tummy treatments. It's very light. The whole device only weighs 1 pound. And it doesn't, it's very lightweight. You really don't notice it on the body at all. It's very, very comfortable. That's another thing, Dawn, now that I think of it, about the masks. The masks are very limited in how and where you can use them. A lot of them are more expensive than a Celluma device, but you can only use them over your face. Whereas you can use the Celluma panel devices for any skin condition and pain condition anywhere on the body. You just can't do that with a mask. The other thing with the masks, and a lot of times, as I said, they're more expensive. The other thing with the mask is, as they sit on the face, they leave indentations, and it can take a while for those indentations to go away. I've been told that sometimes it's more than 24 hours. So you better not buy one of those devices and think you're going to, a big do that night and put that on your face and then have indentations where it's sat on your face. They also tend to get a little sweaty. So it's, they have a lot of drawbacks too.
Okay. What about, I remember during training for Celluma, it was mentioned about hair. So if you were to use a Celluma device on the head, talk to me about that. Like what is there much research behind that?
Well, I wasn't expecting this question, but I can tell you that it's something that we are looking into very closely. And I would say pretty much stay tuned. There could be some very exciting news on that front from Celluma in the next couple of months. But what I can tell you, not about our brand in particular, because again, we will not talk about indications until we're actually approved to talk about those indications. And but I can tell you that red light in the range that is emitted from the Celluma device is supported by a lot of good clinical studies and research out of prestigious institutions to support I suppose it's the promotion of the proliferation in the hair follicle. So it can stimulate the hair follicle. And now I know that if you've lost your hair completely and that follicle is actually dead, it will not do anything to stimulate that. But if there's some still activity and you have thinning hair, we know that it will stimulate those follicles. I can tell you too that the commitment on the part of the client is a big one. It's at least 3 times a week, and it can take up to 9 months to get to the end point.
Okay.
You'll start to see a difference, I'm told, at about the 3-month level, but you need to
Wow.
be prepared to commit to it for 6 to 9 months. It's got, again, this is an area I'm just learning about, but it seems to take the cycle of the follicle and the stimulation seems to just take a long time. A lot of medical aesthetic practices are using red light therapy in conjunction with things like PRP and stem cells and getting some really nice results as well.
Okay, because I have been known to sit down and watch a movie with the Celluma over my head. Fingers crossed it's working.
It won't do any harm, that's for sure.
I'm just going to look here, Denise, to see any other questions that come in.
Sure.
All good. Celluma red light, blue light, does it have other colors? We talked about that a while ago about all the different colors.
You only need blue, red, and near infrared. The other wavelengths, while some of them are not even real wavelengths, though there are yellow wavelengths in the electromagnetic spectrum, and there is a lighter sort of orangey red wavelength, and green certainly exists. It's a real wavelength, but the problem with those wavelengths is they're shallow in their reach, so you need the red to reach into the dermal layer, and then the near infrared reaches into the dermal layer and beyond. So you want the wavelengths that are capable of upregulating mitochondrial function in the dermal layer and the subcutaneous layer. If you're not reaching down into those regions, you're not going to be reaching the target cells that affect most or most of those skin conditions, and the cause of the skin conditions and the problem with the skin actually resides.
Mm-hmm. And Celluma is best used on clean skin, Denise.
Yes.
Nothing else on the skin. I know sometimes people, say use a serum to help enhance the results. No, it's just clean skin, dry skin, place of Celluma, and then your masks or whatever afterwards, your exfoliation toners and so forth.
That is the best protocol, because that's based on, again, science and scientific research. There is no research out there to show that any serum ever made will penetrate deeper into the skin because of the use of light therapy. Now, if you're talking about hyaluronic acid after microneedling or during microneedling, we've already created those little micro channels in the skin, and it's those channels that allow that hyaluronic acid to reach deeper into the tissue.
Yeah.
It's not the light that's actually making it penetrate deeper. So there is no science to support that. You will usually find that coming from either misinformed but well-intentioned people, or from companies that are trying to sell you a mask to use in conjunction with their sheet mask or their serum. And it's really in order to get you to, after you buy the mask, to continually repeat and buy their serum or their product. But the problem is there's no research to support that, and the light therapy may be having no effect on the skin, because light therapy will be deflected by anything that's thick, opaque, or shiny. So you want clean, dry skin, something, think of it just as a matte finish, in order to allow the maximum absorption of the wavelengths by the cells. As soon as it's shiny or reflective or opaque, as a lot of the masks are, a certain amount of the light energy just will not get through. So
there's a few questions with eye protection as well, Denise. Obviously, that's very important to wear eye protection.
So when it comes to laser, the light is delivered in what we call a coherent manner, and laser light is certainly damaging to the eye. When it comes to LEDs, it's delivered differently. It's delivered in what they call an incoherent manner, and that incoherent effect will not damage the eye or the retina. However, a good light therapy company like us will always be there to protect you just in case. And a practitioner like yourself should always at least recommend to your patient that they use eyewear. LED has never harmed anybody's eyes. But some people are also very sensitive to the bright light. So we do recommend that unless you know you're comfortable under the bright lights, that you wear protective eyewear. And we recommend for you and for practitioners that are listening that you provide eyewear to your clients.
Yep.
You want to keep them as comfortable as possible during the session.
Of course, yeah. Someone actually just put in a good question there, because I know a lot of my clients love self-tan on the face. What about using, like if you've used, you know, a self-tanning serum the night before and then you're going to use your Celluma, does that affect?
That's a great question. It seems like the pigment that's left behind does not seem to affect the ability of the cells to absorb the light. I have done some research on that because it sort of stood to reason that it could. So I wanted to know. So our answer at the moment is that if you have any kind of a fake tan on from a spray tan or anything else, it doesn't seem to affect the cell's ability to absorb the energy coming from the device.
Good, okay. And then another question here is, can you use RetinA, which is a prescription strength retinol, in between Celluma sessions? So at the moment I'm using prescription RetinA. I wouldn't use it the same night as I'm using Celluma, but I use it to help heal the skin afterwards, you know, any of that inflammation and dryness in the skin. So yeah.
So what we normally have to say in answer to any of these questions is we have to kind of give a broad answer, and it's sort of also the answer to the lowest common denominator. So we might have a non-professional listening today that if I say you can use, yes, you can certainly use RetinA just like you are, Dawn, they might, and they're not trained to know how to use RetinA in conjunction with light therapy. So we have to, for the safety, for everybody's safety, we actually have to say, don't use it with RetinA, but you can use it with the more diluted retinols. That seems to be safer guidance. But under professional care, certainly under your own care, because you're a trained skincare professional and you understand these ingredients, you seem to be doing great. And under your care, if one of your clients wanted to use under your guidance, then I'd say that's fine. Always consult with a professional before undertaking anything, especially at a prescription level that you may not know or be comfortable with. You know, the RetinA is designed to turn over the skin cells more quickly, and you could find yourself with red patches, especially where you've used the RetinA more heavily, and you don't want to do that. So again, you can quite safely usually use it with retinols, but with RetinA, I would say either don't, unless you're under the care of a professional. This is the benefit of seeing a skincare professional. Yes, Celluma is great to use at home, but it doesn't replace the knowledge and the education and guidance that somebody like you, Dawn, can provide to somebody that's really interested in having long-term and good results for their skincare.
Yeah, I suppose the main thing to take away from this, Denise, is that when researching into a device, either for your clinic or for home use, to actually do your research and to make sure that the device is backed by clinical research and by, you know, FDA approved, and don't get sucked into marketing. I've spoken about this before, about how marketing is just everywhere in the beauty industry, and it's very hard for a consumer to navigate that.
It's very confusing, and that's coming from me, and I'm the brand and marketing manager for the company. And the first thing I often say to when we're at these medical conferences, when a doctor or a skincare professional walks up, the first thing I say is, forget all the marketing that you've ever seen. You need to be able, and even the consumers at home listening in today, you need to be able to decipher between marketing claims and professional scientific claims. There's a big difference, and it's not that complicated, but you have to start with that in mind. Almost anybody, especially non-regulated medical device companies, which is most of those masks out there of unknown origin, nobody is regulating what they're saying, so they can say anything. And as I said, they could have a white bulb with colored glass. You don't even know if it's emitting a wavelength. And people that talk about colors, they're actually, we perceive the wavelength as colors, but that's not what professionals call these colors. We call them wavelengths. So, you know, there are ways for you to work through the nonsense that's out there. The internet can be a great resource, but it also can be very, very confusing. I think the easiest thing to do is go to your skincare professional and then hope that that skincare professional is also educated on the basics. You know, just there's a lot to know. And then, of course, you don't have to be an expert, not just light therapy, but all of the other skincare products and all of the other modalities that are available for you to offer to your clients. It's a lot for you to know, but your clients need to trust that you have the backing of the professional companies that are educating you on the best possible treatments and modalities for best outcomes for your clients. So the first place to start is do your research online, but then try to find a professional that can guide you, because it can be expensive. It can be an expensive investment to buy some of these, especially the mask devices. They seem to be very expensive and they're very popular. They make outrageous claims, and then people are disappointed in the results, and then it really impugns a medical grade device like Celluma. Your customers are going to come into you and they're like, Dawn, I tried light therapy before and it didn't work. So it is hard. I think it's hard for the consumer and the professional alike.
And just to end on this question, it's kind of a personal one, but what's your favorite light to use? I actually love blue light. Like, I know red and near infrared are more powerful, but I love the finish that blue light gives the skin. It's just amazing, especially if you're having any bit of breakout. Like, it's just incredible. What's your favorite one to use?
So, given my age, I like to use the red. The red, for me, I don't have an issue with breakouts and like the superficial issues that you get with acne and breakouts. So it's not that valuable for me. However, in our red light program, there is a lot of blue being emitted. So if I have a little bit of superficial issues or some kind of an acute breakout or something, I know that's going to be taken care of. And I think the reverse is true. And one of the reasons you probably favor our blue light program is there is a ton of red light also being emitted in our blue light program. So yes, we have the blue, which is mostly just killing the P. acne bacteria, but that red wavelength is doing what it always does in any of the programs. It's always reducing inflammation, which is at the root cause of nearly every skin issue we have. It's always increasing microcirculation. When you do that, you bring more oxygen and nutrients into the area. That's generating new, healthier tissue. If you happen to be an acneic client, it will reduce the inflammation of the lesion. It will help those lesions to heal and close faster. It will help keratinocytes to proliferate more, and that gives you that more even skin tone and texture and quality. So that red light in conjunction with the blue is absolutely fantastic. Yeah,
perfect. Okay, well, I think I might leave it there, Denise.
Okay.
We've been on about 44 minutes now, so that was really, really interesting. The response so far has been really, really good. So thank you to everyone for watching and for submitting questions. I'm sorry if we didn't get to all of them.
Well,
but yeah, definitely. And thank you so much. It was really, really lovely chatting to you. And you have the whole day now ahead of you, so enjoy.
and up the Dubs. Woo!
Woo! Well, I'm actually Cork, Denise, so up the Rebels.
Oh, you are? Okay, well, a little rivalry in there. Okay, well, that was
We'll say nothing. Denise, I said we'll say nothing.
Yes, we say no more, say no more.
Up the Rebels. Go on. I'll let you go. And thank you so much, Denise. And I'll chat to you again soon.
Yes, absolutely. Bye, Dawn. Bye, everybody.
Have a lovely day. Bye.
Bye.
Bye.